like to welcome you to Minnesota Pork and especially to this U.S. Swine Health Improvement Plan session. And thank you for being here. Our objective is to give you an overview of where we're at with this program, give you some insight from some of the folks that are already been participating and help us in the development of this plan. And then we're going to leave hopefully plenty of time at the end for Q&A. So we definitely want questions as we go or questions at the end. My name is Tyler Holck. I'm a swine veterinarian. I work with the Swine Health Improvement Plan. I'm based down in Ames, Iowa, and I will kick this off with just an overview and give you a little hint of the direction we're going with this program. So it is the U.S. Swine Health Improvement Plan, and it says in this title slide, development of, because this is something that we started 15 months ago as a pilot supported by the USDA. And this is a program that's across several different institutions and now hundreds of individuals that have also contributed. But the institutions include Iowa State University, University of Illinois, South Dakota State University, and University of Minnesota. And at the University of Minnesota, since we're here, most directly involved is Monty Tormorell and Jerry Torreson. So what I want to do is provide an overview of what we've been doing and where we're going. First, we're focused on Asf and Csf, so African swine fever and classical swine fever. And the intent with this program is to model a program that's been in the poultry industry for 86 years. So we've never had a national playbook for swine health on the swine side, but they've had it on the poultry side now since 1935. The intentions with this program is to establish a national playbook with collaboration from industry, state, and federal levels. And that's been happening on the poultry side. Brian, who's the next speaker, Dr. Hoefs, may mention a little bit about avian influenza that's happening and how the Npip program that this is modeled against is helping that industry even in the face of that disease. So this is in the pilot stage. We're actually in year 2. We're already having conversations with the USDA and the National Pork Board to take this a couple more years of pilot before becoming a formal program. But the key for those in the room right now is that we're focused on prevention. We're still focused on prevention. And what else can we do to assure that we keep ASF out? Everybody knows that if it comes here, we're going to have some grave economic impact from a foreign animal disease because U.S. international trade stops. So we're focused on prevention. If it does get in the country, we're also focused on demonstrating the freedom of disease in regions where that disease is not. This diagram shows the model that's in place for the NPIP, or the National Poultry Improvement Plan. And it basically gathers in producers, the industry, it gathers in state animal health officials, and they come together in what's called a House of Delegates in the NPIP model every 2 years to talk about what do we need to have in place. And the focus areas are biosecurity, traceability, and surveillance. And the NPIP, which is a formal program under the USDA, what they vote on at that House of Delegates, what the producers vote on at that House of Delegates become the regulations in the Code of Federal Regulations. In our pilot, we're essentially establishing a foundation for some standards that we would say by enrolling in U.S. SHIP, being certified for ASF and CSF, these are the things that you need to do. Our intentions are, within the next 2 to 3 years, is to make it a formal program just like the NPIP. So the purpose of our program, first and foremost, is to continue to help with foreign animal disease preparedness. And again, the focus is prevention, but if need be, it's also response and recovery. By doing this national program, by getting everybody playing by the same rules, we also see a positive benefit of improving the U.S. herd's health by reducing the impact of endemic diseases, like PRRS that you'll hear about at 1 o'clock. The pilot was initiated by the USDA, and they are continuing to support it along with the Pork Board because of this third bullet point, which is This gives our swine industry an opportunity to experience a very successful program that's recognized internationally that they've had in the poultry industry since 1935. So what does an NPIP program look like for swine? Year one, which was last year, we focused again on biosecurity, traceability, and surveillance, or sampling and testing. And we put together committees, which many Minnesotans were involved, including Mark Schwartz, who will present later in this session. We had around 100 subject matter experts in these areas, and they provided us input of what do we need to be thinking about in the context of Asf and Csf. Our guiding principles for all of this work in setting up this program from scratch is don't recreate the wheel. So if we've got secure pork supply, well, we're not going to create another secure pork supply. We're going to figure out how does that work within SHIP. Keep it simple, keep it broadly inclusive, make sure it's scalable and flexible, because for this to work in the poultry industry, they have over 99% of the industry involved, and it's voluntary. For this to work, we need to have the vast majority of the swine industry involved. So it's got to be scalable, flexible, synergistic with other FAD preparedness efforts, because we know there's a lot of those that are going on. I'm encouraged because the conversations now are, how do all these come together? And obviously it needs to be founded on sound science and practical science. Questions we ask ourselves as we're putting this together are, does this effort improve our status quo for foreign animal disease preparedness? Will a broad spectrum of producers and packers participate? Can it be implemented across the broad range of our U.S. swine industry, which is obviously different than the poultry industry? And probably most importantly is give us the grace and the latitude that can it be improved and updated over time. So at this point, we're building a foundation, but long term, we see this as a program that will be helpful not only for ASF or CSF, but the opportunity to include endemic diseases, mycoplasma, PED, potentially PRRS. We did have our first House of Delegates. So again, the model in NPIP is get everybody in the room representing the states that want to participate. On the poultry side, all 50 states. Get everybody in the room and talk about what do we need to be doing. We did this last August. The first House of Delegates was in Des Moines. I see a few faces that you were there. When I started with this project in the fall of 2020, my expectations with Roger Main, whose vision for this program is what we're working on, we said if we get 10 to 15 states in this first 2 years, that'll be a success. If we get many of the key swine states, that'll be a success. By the time we got to the House of Delegates last summer, we had 28 states that were expressing interest. 27 sent delegates. So we had a full House in Des Moines in August to talk about and get some of the initial requirements settled for this program. This slide represents all the states that have expressed interest, which obviously includes Minnesota. So those of you that are here that are in production or packing, we certainly hope that you will sign up with this program and help us get the momentum moving forward. But you can see all of the major swine states, all the top 15 states are participating, and then we've got an additional 13 states beyond that. Just real quick, when we finish with that House of Delegates, you know, one of the litmus tests is, well, for those of you that spent 2 days working on this together in a House of Delegates, did you see value in it? Do you think this program should go forward? And the obvious answer from those that participated was, yeah, we agree. There's value. We need to push this forward. So here are the requirements in a simple format that came out of that first House of Delegates. For those that want to enroll, enrollment's going to be at the site level. You need to have a valid veterinary client-patient relationship, okay? So with an accredited veterinarian. From a biosecurity standpoint, 2 different areas. One in feeding practices, which this was quite contentious. We ended the meeting with a business meeting in which we brought up these proposals. They were discussed and then voted on, and this one had quite a bit of discussion that went on garbage feeding. Because in 26 states it's legal. And yet, for the betterment of the industry, as we think about how ASF is spread around the world so far, we're thinking that's probably not a good idea. So it came up. It was not a unanimous vote, but it passed to prohibit garbage feeding that would have meat in it. The other biosecurity was just laying a standardization for what's the downtime when coming back from an ASF, CSF positive region or state. And that was agreed upon to be 5 days if you were around pigs or any potential to have exposure in that country. That's probably already happening today in many of our farms, but again, this is a national playbook where we say, hey, let's all adhere to this. So you can see right there, those two really focus on prevention. Traceability standards, this is as simple as blocking and tackling. Do we really know where the pigs are? When the animal health officials need to know where those pigs are, do we have that on record, and can we find them? Brian might expand on that a little bit, but we were just talking before the program this morning about currently in the EMERS, Emergency Management System for the United States, there's a lot of errors in there with regard to where sites are. So we need to tighten that up in case we need to use that. The other thing about traceability is we're going to require that the sites that enroll be able to show swine movement in and out of their system, in and out of their site for 30 days. They need to be able to show in this first year the ability to share that data. It's not going to necessarily be shared all the time, but the ability to share it. And that's where we're starting to move, and I'll have a slide here in a minute, in collaboration with AgView, for example, as one of the tools. There's other things like MetaFarms and other programs where you already have that information. Well, that's fine. Let's flow it from there. But the point is, can we show movement of the pigs? And finally, surveillance. This is an area that we certainly need to expand on. We could spend an hour, we could spend a whole morning on this topic. Suffice it to say, this first year, there are no requirements for testing or sampling. I would anticipate at the next House of Delegates, which is scheduled for this September, actually up here in Minnesota, at this next House of Delegates, we'll come forth with some proposals for the House of Delegates to consider where we would at least initiate sampling and show proficiency in sampling for the sample types that are required. We're also working with the USDA to make sure they're comfortable that we've got comfort with actually starting the testing, and in the event that we have a non-negative result, what do we do with that? So there's a lot of work to be done, but this is basically where we're starting with our initial requirements for the first year. This slide just shows you the collaboration that we've got going with the National Pork Board. So, for example, in traceability, we're using AgView in one of the first pilots that we're having across an entire supply chain. Biosecurity, one of the working groups, is focused on how do we work secure pork supply into the standards for U.S. ship. And then, as I just mentioned, Certified Sampler Program is one that would fit very well with what we're trying to do in sampling and testing or surveillance. Real quick as I finish up, this program is voluntary. At the producer level and packer level, it's registering your sites. And you basically, all you need to do is enroll, show the ability to be compliant with these requirements that I just mentioned, and at the certification would be at the site level. Who monitors this? It's at the state level, and the next speaker, Brian Hoefs, who's veterinarian with the Board of Animal Health, will describe a little bit about what that looks like, because it's the official state agency that oversees this program. So each of the states that participate, they'll name their organization that's going to oversee it, and they will administer it. You'll be sending your information to them, and that allows that information to be secure, and then they will also be providing the certification. So my last slide, why should you participate? Well, it improves our ASF and CSF preparedness across the country, and again, at this point, we're focused on prevention. When this program is fully implemented, it allows us the opportunity, which we don't have today, to demonstrate freedom of disease if that disease is in the country. As you probably have seen already with the NPIP, when that's in place, when SHIP would be in place, you could streamline your interstate movement even with an introduction of the disease. And probably most importantly, what's the quickest way we can get back to international trade? So the last point is talking about improved health in the commercial production, and we certainly see that with the implementation of some of the biosecurity requirements. But essentially, it's a national playbook that we need everybody to get involved in. And if nothing else, with the threat of ASF, think about that for getting back to international trade. This is just a slide that shows at the top where today we're focused on, well, if it comes, we're going to be focused on control zones, right? But who's thinking about everything else that's outside of the control zone? And that's where U.S. SHIP can come into play. So with that, keep jotting down questions. We're going to have a Q&A session at the end. At this point, I would like to introduce Dr. Brian Hoefs. Brian is a swine veterinarian with the Board of Animal Health up here in Minnesota, and Brian's going to give you just a brief overview of what they're doing up here in Minnesota to set up an official state agency for SHIP.
Tyler. So I'm with the Minnesota Board of Animal Health. I'm senior veterinarian. One of my roles is overseeing swine programs. So this the swine health improvement plan is right in our wheelhouse, and I hope to illustrate that a little bit in my short presentation. So my first slide. I think the name of our agency is incorrect. We are better named the Board of Animal Disease Management, and as Tyler mentioned, we're kind of in the throes of what that means with avian influenza on our doorstep again. So specifically, we have three roles within disease management. We ensure prevention, detection, and then control of diseases once they arrive. So I've put the bubble slide that Tyler had up to kind of illustrate where that comes into play with the SHIP program. So prevention is our emergency planning phase of disease, and biosecurity obviously is our best way to prevent disease. Detection, so foreign animal disease response. How do we know disease is there? And that's where the surveillance and diagnostic tools come into place. And then finally, when we have a disease in place, what are we doing about it? How do we control that disease while continuing with business? So traceability becomes huge with that in mind. So biosecurity, what does biosecurity look like before disease and during disease? So I think it's pretty obvious that prior to a disease event, just the general well-being of your herd is at stake, and that's the importance of biosecurity when we're in peacetime. Also, preventing introduction of disease. These are aspects that everyone's familiar with. But then, during a disease event, what does it matter then? What's the difference there? So now we're talking about biosecurity being required for permitted movement. So if we're in the middle of a disease event, and I'll use avian influenza as an example, we already have poultry producers contacting us to establish that they are going to be able to move birds if and when avian influenza gets to Minnesota. So same thing would apply with a swine disease. We need to have those things in place just to streamline your ability to continue moving hogs. The last bullet there, I'm a little nearsighted. The herd plan and indemnity, I've got kind of a question mark there. That's something to consider with your biosecurity plans too. We know this comes into play with our avian influenza response. If flocks are depopulated, indemnity relies on your herd plan and your biosecurity plan. So I can't say exactly how that will play out for swine, but we anticipate the same type of response. Sampling and testing prior to disease. It's important, obviously, to identify any outbreaks early. So we want to be on the forefront of any disease. The sooner we know about an incursion, the sooner we can deal with it. During a disease, again, this is going to directly determine how we manage the the disease. So what are our management strategies? So some of these things will be more obvious during an event, but again, with our poultry industry, if we know avian influenza is on the rise and in the environment, we had situations where people were able to process their turkeys early before they had a chance to get infected. So same aspects apply with the swine industry. The rest of that management is, how do we deal with movement? Is there an opportunity to do some pre-movement isolation periods that will allow us to keep business going? What herds need to be depopulated? And then again, the permitted movement. So I'm trying to get that point emphasized. This is going to be essential for allowing your pigs to move. Even if your pigs aren't affected, it's part of the process to get a permit to allow pigs to move during a disease event. Traceability, our last main area. Prior to a disease event, it's compiling records. It's kind of the boring part of preparing for a disease. We archive lots of records that eventually we don't use. And it doesn't seem that important at the onset, but talk to our poultry colleagues and they'll tell you differently. So when a disease event comes, we need those records for traceability to establish epidemiologic traces, so we know where herds are going, where they've come from, establishing the control area, and again, for permitted movement, we need to know your movement records so we can allow you to continue moving if it's safe. So our big concern is controlling the disease, but also continuity of business. So prevent disease, detect disease, control disease, but ultimately our goal is to permit movement when and where possible during a disease event and to allow you to continue shipping hogs and doing business as normal as possible. So we're excited to be part of the ship enrollment program. I put a couple of a website up there as well as my email address. You don't have to scramble to write it down. If you do a search for the Board of Animal Health, you'll find us pretty easily. Our plan is to have those documents for enrollment right on our website, so it'll be an automatic one-stop shop. You can apply online. It'll be directed to myself or one of my staff to process the applications, and we are anticipating being ready to roll by March 1st, accepting those applications. All right, thank you.
Thanks, Brian. Our next speaker is Dr. Scott D., and Scott will be joining us remotely, but many of you, if not most of you, know Dr. D. Was at the University of Minnesota for many years and now is currently with Pipestone in the Director of Research. And Scott will be joining us remotely and giving us his viewpoint of engagement with SHIP and being more specific, looking at some of the aspects of biosecurity. So, Scott, can you hear us?
I can hear you, Tyler. I could hear the presentations, so I think it's all loud and clear. Can you hear me and see me okay?
We can hear you, and we have slides up. If you can see them, I'll advance them for you.
Perfect. Okay, well, thank you so much for a few minutes of your busy time today, members of the pork industry of Minnesota. In my 35 years as a veterinarian, I've never been more excited about what I see happening at the level of the U.S. SHIP. So I'm honored to be playing a small role. And what I'm going to do for you today is just show you the progress, one example of progress that this really cool organization, U.S. SHIP, is already moving forward. Basically actions taken and deliverables around the topic that's near and dear to my heart, that is feed biosecurity. So next slide, please. So why do we need a national program of feed biosecurity? Well, it goes both ways. It's for prevention of introduction of diseases, as well as if these viruses get into the United States, they're going to move all over the place in the feed. And so we have to have a plan to deal with that risk factor. This feed is a very new risk factor. And look at all the viruses that can live in feed. And many of these have been demonstrated to be transmitted through feed. pretty scary list right there. Not only domestic diseases, but also transboundary foreign animal diseases. So we really need a national program to manage this, and that's why I'm so excited about SHIP. SHIP is the first organization that says, yes, this is a serious risk and we have to put it into our plan. Next slide, please. So I'm going to show you two things that have already happened. That's what I like about SHIP. It's moving fast and there's progress. One is an infrastructure movement, a formation of a working group that I've been honored to be asked to be part of under the leadership of Dr. Jordan Gebhardt, who's a scientist at Kansas State University. You might know Jordan. He's fantastic. And he's going to lead this working group in the feed risk. And you see some of his language here that he's put forth to us as members of that group. Our goal is to facilitate the U.S. Swine Health Improvement Plan Feed Biosecurity Working Group, propose specific recommendations to the House of Delegates when we meet back in 2022. And you see the two objectives that Jordan has outlined for us to work on: determine appropriate best practice guidelines for exclusion or responsible import of feed and feed ingredients from ASF and CSF positive countries. So how do we safely either bring these important ingredients in from high-risk countries? How do we do it scientifically, safely, or do we completely exclude them? We're going to talk about both sides of the equation. Objective 2 is we need to develop industry standards for feed biosecurity that can be rapidly implemented across the swine and feed industry. In the event that these two viruses enter the U.S. domestic or feral swine populations, that's the other side of the coin. It's not just prevention into the country, as Tyler said, is managing the diseases should they enter. Talk about a way to move these diseases quickly across the landscape. It's through contaminated feed. So we have to look at if and we have to look at when. So I really respect Jordan, and I'm glad to be part of this working group. And it's nice to see how quickly this is getting started. We're actually meeting very shortly. We've got several meetings scheduled, and we'll be moving on all cylinders to get these objectives dealt with. Next slide. I used the term responsible imports, and this is a vision that Luke Minion had, our CEO at Pipestone, several years ago, that we've put together with the help of a company out of Minneapolis called SAM Nutrition. And so the responsible imports is a protocol to safely introduce feed and feed ingredients from countries of high risk. These could be vitamins that we don't make in the U.S. These could be products that it's so cost beneficial to bring them in for your bottom line economically that is there a way we can do this safely using science? And as I mentioned, SAM Nutrition and Pipestone sat down together, and SAM Nutrition is our pioneer responsible imports company that's got a protocol that we've co-written that's working right now to bring in vitamins, amino acids, trace minerals, essential ingredients from China and do it in a safe, scientifically sound way. So this is already up and running, and it's already written down. And we've shared that protocol with SHIP as a deliverable to the industry and said, here's something we've already got in black and white. Here's something that's working. And that's what I'm excited about working with the SHIP is they want to make progress. And so I just wanted to let you know that there's already a lot of stuff happening in the area of feed biosecurity, again, in the infrastructure side, and then the deliverable of this protocol that you can basically take and put it into operation right away. You know, it's that far along in its written aspects as well as its logistic aspect. And so it's working. We've been using it for several years. And so I'm excited because I've never seen anything come together as quickly with the goal of keeping these diseases out of the country and really a producer-driven plan. So I'm very excited. I'm looking forward to the panel discussion. I don't want to take too much time talking. I'll turn it over then back to Tyler. But that's some progress that we've already got going for you to get this thing off the ground. So thanks a million. Appreciate it. Looking forward to the panel.
Thanks very much, Scott. And yeah, you will be available for the panel. That'll be great. Our last speaker before we have panel and Q&A time is Mark Schwartz. Mark is the Director of Production at Schwartz Farms. Mark, in his spare time, is also a student at the University of Minnesota, working in graduate in epidemiology, and is a layman fellow there. So Mark doesn't leave himself a lot of spare time, but we appreciate you spending a little bit of time with us this morning. Mark was involved in some of the committee work, and then I just about killed him at the first House of Delegates because we went for a brief walk when it was 100 degrees in Des Moines, but Mark made it back to the House of Delegates, so that was good. But Mark, thanks for being here, and he's going to share a little bit of his experiences.
Thank you, Tyler. Thank you for this opportunity to visit with you today. So just very briefly, to follow up on Dr. Tyler Holck and Brian Hoef and Hoefs, and Dr. D. So as a producer, what do I see as important as the next steps in SHIP? And so it's important, I think, to some background here. We had a wake-up call, I think it was May 13th, 15th of 2013 with PED. There's this new virus in the U.S., transboundary disease. I hadn't heard that word, didn't know what that meant. It was not FAD. That was the good news. The scary part was here, and the work of the ASV, it was prevalent within weeks across our industry, based on trailer surveillance at the packing plants. And so that was a wake-up call that formed SHIC, the Swine Health Improvement Center. Our next wake-up call was August, was it 2nd of 18, when China announced ASF. It was about 8 months before that. I was in China visiting with Keith Erlinson, who was with CP Group at the time. I asked him, what keeps you up at night taking production in China? He says, my fear is ASF coming into China from the north. And that's exactly what happened about 8 months later. So this is an idea whose time has come. It's overdue. The work of individuals at the 4 land-grant institutions who got this idea going. I remember Dr. Roger Main was key, Dr. Zimmerman, Torrison, Tormorell, and others. And so again, SHIC directs research, and I'm on that board and have been. And people say, well, that's really good, you guys did that, you'll prevent the next PED. No. We direct research on developing assays to help, but it's not there to prevent, per se, the next introduction of a disease or a pathogen into this country. SHIP, I would say we're looking at that being prevention is key in our first phase of SHIP to prevent that. So that's the difference. So that feasibility study for SHIP was completed and introduced, and with funding from USDA, we're able to launch this. So the U.S. swine industry has gone from this high labor, low capital, seasonal production from many years ago to a complex, high capital investment, multi-site production with interstate movement, cross-country movement of pigs on a daily basis. The globalization that we've experienced and our dependence on exports is a unique situation compared to 20, 30 years ago. We have to export 30% of our output, or we're going to downsize our industry. So it's very critical that as producers, as leaders in industry, we get on board on this initiative to make this happen. You know, the time to get done is now. The old saying, when's the best time to plant a tree? 30 years ago, the next best time today. That's this. This would have been great to be in place in the early 90s. It wasn't. It's time to get it going. You know, I've heard the comment, well, NPIP, that was 1935, that was easier different times. I don't know, you could argue the opposite of that. You look at the foresight of that program in NPIP back 86 years ago, it's time for us to get caught up. Why? From an industry perspective, participation will result in this robust, vibrant industry for the future. From an individual perspective, first is prevention, biosecurity, demonstration of freedom from disease, and providing a means of business continuity, God forbid, in the event that we have to go to the next phases of SHIP in surveillance as a means of regionalization and compartmentalization. So getting on board is simple, right? And Dr. Hoefs mentioned that the enrollment process will be going here in a couple of weeks. We're using existing formats already. We're not reinventing the wheel. The secure pork supply will be the basis for the biosecurity plans, the AgView or other movement database information for traceability. So, and then having that veterinary client-patient relationship. So really getting on board is step one. Most everyone here probably has secure pork completed and ready to go. You use that as your basis for biosecurity. So, you know, the stakeholders mentioned in SHIP is industry, and really talk stakeholders for pork producers, it's us as producers, but you look at the farm employees, our contract growers, the owners themselves, the allied industry, the transport industry, the feed milling industry, the consultants, the veterinarians. I mean, our industry touches many, many, many lives, and our responsibility to take this step to move on and to improve ourselves as producers in industry. Really, to steal a Stephen Covey line, you know, we got to think at a different level to solve a problem than we did when we created the problem in the first place. And so SHIP is that first step in that direction. So what we need is mass participation. We need a critical mass. We need a high percent of the industry to be enrolled in SHIP for this to be successful. SHIP will provide this clear and uniform standards going forward. We utilize secure pork and the current movement databases. Our goal, again, is prevention, first of all, and then demonstration of freedom of disease, and then in the event that we would need to have that as an ongoing method in our industry for continuity of business. Thank you.
Okay, thanks for sitting through a rapid series of presentations, but now we want to open up the floor for questions. So we've got Dr. Dion remotely, we've got Mark who just spoke with a producer's perspective, we got Dr. Hoefs here from the Board of Animal Health. I'm looking around the room and I see a few of our subject matter experts, including one texting up against the back wall in surveillance and sampling, Dr. Jerry Torreson. Oh, you don't have to put your phone away, that's okay. I don't take anything personal anymore. But we've got several folks, and we're here to answer some questions or just open up the dialogue relative to U.S. SHIP. So I'll just stand up here. You guys got some mics there. Okay. All right. Questions, comments, concerns, excitement. All right, we're going to seed this a little bit, and since I already, you have a question? Good. Be ready, Jerry. I'm going to go to you next.
Dr. Hoef, my question is, I maybe missed it, the indemnification. I did not follow your thought line on what you were referring to there. And then my second question is transportation. What is the SHIP program thinking once it's identified in the country to ship animals? Are you talking hours, days, weeks? I'm in the multiplication business, and we don't have, on both sites, we do not have the capability of carrying over gilts for 2 weeks. And so there's some big replication to the major genetic lines and the downstream vendors.
Great questions. I'll answer your first one, the indemnity portion. So typically when we have a mass mortality event, a disease event, and the USDA is involved, we get some federal support, there's opportunity for indemnity to pay for those animals that are depopulated because of a disease, so to protect the rest of the herd, basically. And I can't say that's actually going to happen for sure because I'm not with the USDA, but history has told us that's kind of the process that we follow. So in avian influenza, that's certainly what happened. Here in Minnesota, we run into this occasionally with our farm deer herds that are testing positive for chronic wasting disease, and they need to be depopulated. There's indemnity provided by the USDA for those. So that's what I'm referring to with the indemnity. Having all those things in place, your biosecurity, a herd plan, so they know that you're on top of things that greases the skid, so to speak, for them to allow that indemnity. As far as transportation, unfortunately, I have to say that depends. It depends a little bit on where the event occurs and how close you are to that. So Tyler and I both had some slides up with circles, kind of a target-looking thing. You know, there's the middle index area where we have infected herds, and then we've got kind of buffer zones and the whole control area, basically. And that's what's going to determine if you need to be permitted or not. So the length of time it takes to get permitted is exponentially quicker if you have all these things in place that we're looking for with the SHIP program. So having your biosecurity plans on record so we know that there's one in place. Elevated biosecurity plans certainly are crucial in those events, demonstrating where your movements are going and have come from so we can determine if there's any epidemiologic link. So I say it depends, but I will also say that having that information on file in a SHIP program allows us to move more quickly.
Can I just a little bit more on that, Brian, just to confirm, but in the case of an incursion, if that does happen, there's a federal standstill for a minimum of 72 hours, right? So there'll be no movement whatsoever. I think pigs that are on the road have a 12-hour grace period to get to where they're going or find a place to go. But there's a 72-hour federal mandate on a shutdown. What's interesting is today, without this program being formally in place, it's then up to the states when they open up. It's the state's decision when they're going to open up for movement. And that may be different and likely will be today, state to state. Part of the interest in SHIP is, can we put a national playbook together for what that looks like? Is that close to accurate, Brian, on the 72 hours and then it's up to the state to open back up?
Right, yeah. Yeah, so the 72 hours is a national standstill. That's something the USDA will invoke, and then after that, the states determine what movement will allow within the state. So, and being a huge pork production state, we're interested in moving as quickly as possible.
My last question is then, after the moratorium, we ship in about a 7 or 8 state area every 30 days. Are all states going to be on board, or is there going to be various politics involved? How do you get through one state to get to your delivery point? Thank you.
Another great question, and everything's always political these days. That being said, we work very closely with a multi-state organization of state animal health officials, specifically in swine-intensive states. So we are actively, myself and Dr. Thompson are in meetings weekly, bi-weekly, a lot of times to discuss that, just the idea of how we can regionalize, how we can work together to maintain continuity of business. So we're trying to play off the same plans as Tyler's referred to with the SHIP program, but in general, we're trying to recognize that the pig business isn't just in Iowa, it's not just in Minnesota. We've got lots of states involved. So there's an ongoing effort to make sure that everyone's on the same page, and I would say a majority of aspects we are.
To kind of build on that question, you said March 1, Minnesota will be ready to roll with enrollment and whatever. What about the other states? Are they operating on the same timeline?
Yeah, similar timeline. So what we've been doing with the core group is meeting monthly with all the states that are interested, so Minnesota being one. We basically set up to target by the end of the first quarter, so by the end of March, that all the states that are going to participate are ready, right? But again, for each state, they will be administering. So if you have production in different states, you'll be dealing with Minnesota Board of Animal Health, you might be dealing with the Iowa Department of Land Stewardship, and on our website, or there'll be information available for who the state agency is for the different states. But the target is the end of first quarter, end of March. Our House of Delegates that I mentioned, the reason that's important is, as Scott mentioned, we are moving as quickly as we can to put this together. Our House of Delegates is in September, and we want to continue to build momentum towards that so that we can make the program more and more robust.
I have a question over here. You mentioned there's a federal definition of stop movement. Does that include just pigs, or does that mean no pigs, no feed, no people? And then does each state have their own definition of what stop applies to?
That's a good question. I think that the stop movement is specifically related to live hog movement. And as Tyler mentioned, it's a stop movement. Anything that's on the road is allowed to make it to their destination, and then 72 hours, nothing moves. From there, there's a little bit of a discussion between states on what else is going to stop. In Minnesota, that's kind of the extent of it. We don't want to limit feed deliveries. We don't want to limit some of the other essentials for keeping the herds going, keeping them fed. But that will vary state to state. On the surface, it's livestock, 72-hour standstill of livestock. Some states are also imposing standstill of anything coming or going off of farms.
Is there like a site that helps explain that for this gentleman over here who has multi-state operations? Is there a way to figure that out?
I think you'd have to contact the state animal health officials to find out what their interpretation of that is going to be. And that's one of the things that we're discussing in these multi-state meetings, trying to come a little closer. We've had states that have relaxed a little bit on some of their restrictions and are a little closer to what we're looking at in Minnesota.
Other questions? Kind of looking at Dr. Torreson in the back if you want to work your way there. Jerry, you've been very involved in this program from the get-go, and you primarily focused on the surveillance or sampling and testing. And we've made great strides with, well, what might that look like? What does it need to look like to be both functional but cost-effective and also comfort with we're actually doing surveillance in peacetime? So my question, or if you want to maybe share a little bit of some of the things that are going on behind the scenes with the USDA, for example, with how do we get to that point? Because that's where we all feel we need to be. But you want to comment a little bit on that work?
Sure. How much time do we have, right? Hi, my name is Jerry Torreson. I'm the director of the Veterinary Diagnostic Lab. And where's Chrysler? I just dropped the wrapper from my pack pin here. I just want to show that off. So yeah, we've been really involved. There's a group that has been working to understand what's possible. So with African swine fever, there are a lot of regulations, obviously, and that's really important. The labs have standardized tests. Everyone's proficiency tested in order to provide this testing that's recognized internationally. And then we want to interface at the farm level, where there might be samples that people routinely submit for surveillance, so processing fluid, oral fluids, some of those things that aren't recognized by USDA or internationally. And so part of this whole project is to influence the process so that more samples that people are routinely taking can be used as part of a surveillance program. Not only that, so what lessons have we learned recently about diagnostic testing surge capacity and running out of products and running out of swabs and all that stuff? We need flexibility. And so some of the things that we've been working on is expanding the types of test kits that we can use for these official tests, expanding the types of samples that can be collected and submitted and used for this surveillance. And it's a process, right? USDA doesn't spin on a dime. They can't because it's part of this whole international standardization thing. But those are some of the areas where we've been working. And so the intent is that peacetime surveillance, as we're calling it, before there's any African swine fever in the U.S., which hopefully is forever, there would be a more simple way of submitting samples that are what we call population-based or aggregate sampling. So oral fluids. How many people have ever collected oral fluids in the room? Anybody? So a few? Yeah, quite a few. And so we want to take advantage of what people already know how to do. And by the way, it's a really sensitive sample that detects infections early and covers a broad population, and you don't have to go and swab each pig or get a spleen sample or something more exotic than that. And so we're trying to pave the way for an efficient, cost-effective sampling frame that can be used in the event of an outbreak in the U.S. Does that help with the explanation?
It's good. Yeah, I think it's important to know that there's collaboration that needs to happen with the USDA in order for them to be comfortable for us to be doing that. Because today, our demonstration of the freedom of disease is we say, well, it's not here, essentially. We do some testing today. Your lab, for example, will follow up on some cases, but those are live animal cases, which that's good. But as far as just general surveillance, I think, yeah, that's the point. Is we need to
I might just take a second to explain that. So we get asked quite a bit, are we doing any surveillance for African swine fever? And the answer is yes. We have a stream of samples that we get. So regular diagnostic submissions, if the case history and the sample types are compatible with, so if there's mortality or fever or a few other things that make it seem like it could be African swine fever, we can test those samples. So that's an active surveillance process that's happening in, I think, 9 or 10 diagnostic labs across the country. We also get sample submissions from slaughter plants where they will collect tonsils usually and send samples to us or other labs for routine sampling and testing. And so there is this surveillance stream, and it winds up being at our lab a few hundred per month. And so you can say, well, that's not a ton, but it's not nothing either. So it is a surveillance program that's in place. And so for classical swine fever, it's been in place for over 10 years. For African swine fever, it's been for the last year and a half, 2 years.
Perfect. Not to put you on the spot, but I just saw Dr. Yeski walk in, and you, along with Jerry, what was that committee, 30, 40 people? And just so you know, the way that worked was folks from the lab, folks from the field like Dr. Yeski, along with the USDA, having the conversation of where do we need to be? And that's sort of the spirit of the collaboration with industry, state, and federal. So, yeah, thanks, Jerry. Any other questions on sampling or surveillance while Jerry had the mic? Okay, there's some more questions here. Good.
So this might be a little out there, but I'm curious, in your discussions, has wild hogs, feral hogs, been addressed? Because it's such a huge business today to go wild hog hunting, and then, they're bringing that meat everywhere. And when we talk about biosecurity and looking at foreign countries where a lot of African swine fever actually starts, is in the feral hogs, how are we going to control that here in the U.S.?
Yeah, I'd just put 2 comments in if anybody else wants to share beyond that. It's recognized as a concern, as a need. In the first year, that wasn't something that we were going to tackle. We were doing more of the low-hanging fruit. I anticipate it's going to be a big discussion at this upcoming next House of Delegates. The other part is we're trying to understand with the USDA tracks where feral pigs are at, right? And so we're trying to understand how accurate that might be, if we can use that at a regional basis to know, for example, another classification when we're talking about sampling is a non-feral pig region versus a feral pig region. Today, for example, the maps show no feral pigs in Iowa or Minnesota, but they are in Missouri. So it's recognized. We need to get there. There are no specific requirements today relative to feral pigs. But great point, and it is a concern, as I think several of the speakers mentioned. Other questions? I'm going to turn to Mark, and while you continue to think of some questions or comments or feedback, but Mark. Sure. Here.
So John Schwartz had a question, but he's bashful, so he didn't want to ask it on the microphone. But he was asking what happens if in our surveillance we pop a positive on a test. So that doesn't shut the country down. You know, if that's a concern, it should be a concern. But the idea is that would initiate what's called a foreign animal disease investigation. And so we would notify the state animal health official and USDA and the farm and the vet. And they would then, so somebody from the state or USDA would go out to the farm, collect additional samples, review the clinical signs. The samples would probably come back to us and to the Foreign Animal Disease Lab in Plum Island, New York. And so there would be a thorough foreign animal disease investigation. If it's confirmed, then that's the big one. But if it's not, then that was just a test that had to be investigated. So is that any other questions on that? Okay, thanks. Good question, John.
So, Mark, you were involved in a working group, and you're going to be involved in a further working group looking at transportation sanitation or truck wash. You want to just cover kind of big picture, some of the issues trying to be tackled there?
Thank you, Tyler. So that working group on transportation sanitation is just formed at the last, or the initial House of Delegate meeting. Again, this area of transportation sanitation, biosecurity, in my opinion, is our Achilles heel, as the PED study showed in 2013. We had PED across broad ranges of the U.S. in a matter of weeks. So the most likely way of movement of a pathogen around the country will be a shedding pig. The vehicle was hauled on and the people that hauled it and mixed up with it. And so our ability, our infrastructure to wash, market, transport trailers, trucks and trailers is very, very limited. There's no way with our current infrastructure we can get that done. That's the major concern, a major concern. So as a working group, how do we move toward some standards of transport sanitation? Europe has a system in place. We are the exact opposite with limited washing, limited infrastructure, and very, again, it's expensive. We better hope that introduction, God forbid, of ASF is in a remote area of production with a 3 to 15 day incubation period, and 400,000 pigs moved to slaughter per week. It better be in a remote area, or we're going to have longer than a 72-hour shutdown by far. And so that's an area that's of extreme importance. It's a focus of the working group, and as a delegate body then to come up with solutions, resolutions to answer that, to respond to that need.
Yeah, and just not that you need to know the logistics, although any of you that are interested in being engaged in that, reach out to the Minnesota Pork Association or Brian, because there's delegates that come to this House of Delegates. But essentially these working groups work up what they think is a reasonable proposal, and that's what's brought forward to the House of Delegates. So there's a lot of time and effort put in before it comes before the House of Delegates, and that's an example with truck wash. Other questions? Because I do, Scott, if you wouldn't mind, could you take a minute or two and just go into a little more depth about responsible imports, and maybe not so much the hurdles that have occurred nationally on that, but trying to figure out how do we implement this and implement this in a timely fashion. You want to expand on it a little bit more?
Sure, happy to. As I mentioned, this is a deliverable. SHIP is going to be based on standards, be it standards of surveillance, traceability, et cetera. This is a protocol that can serve as a standard to get this aspect of SHIP, that is feed biosecurity, up and running fast. Rather than inventing the wheel, it's already invented and it's already working. And we've gifted that along with SAM Nutrition to SHIP as a way to help get this started. So that's the aspect why we brought it to the table, is to get this process up and running as fast as we could and to get a deliverable to the industry. But basically what it consists of is a multi-phased approach to looking at how to safely import products from, say, China. So when we do this, we actually audit and provide certification at the manufacturing plant. We use one-time totes and sealed containers to ship from the manufacturing plant to the SAM Nutrition warehouse, which I mentioned is a responsible import pioneer in Minnesota. At that time, the products go into a quarantine room, an actual quarantine room in a facility that's for a 30-day period at 75 degrees Fahrenheit. So it's an established protocol of holding the product, which, as you know, decreases virus survival. And then it's moved out to the mills. And so it's a way to ensure the safety of our imports. And the good news about this is it's already written up, it's already organized, it's already been validated, and it's basically, here's something we can do right away. And sure, there could be a few tweaks to it here and there, but it's a concept that we think is really important to develop the standard so the feed biosecurity aspect of U.S. SHIP can have something that can deliver already to the industry. So I don't know, if Tyler, if you need more detail than that, but that's kind of how it works, and that's kind of why we, from Pipestone and SAM, brought it to SHIP.
No, that's great, Scott. Any further questions for Scott or expansion on that as far as what they're already doing?
I think there are some other.
We do have a question,
sorry.
Scott. Dean. Yep.
Is that program supported or validated in any way by AFIA, the broader industry? Because SAM is in the feed additive segment is a decent sized player, but there are 100 other companies. So I'm wondering if it is, how widespread it is.
Yeah, good question. I was actually just going to jump into that too. So thanks for thinking along the same lines. Yeah, AFIA is familiar with this protocol. I presented it to AFIA. They're very well informed on this. They like it. They think it's a good idea. And this concept of holding products is not new. It's something we started back when ASF came into China in anticipation. There are multiple companies, both production and feed related companies, that have programs like this already in place. What we're trying to do perhaps is put some standards around it to get a consistent approach. For example, what's the right temperature for the period of time to hold the product? We've done some research that's answered that question. So I think the concept is there. There's quite a few companies that are already doing it. We just want to be sure that it's standardized and it's following the best science and as consistent as we can across organization to organization. So we're all kind of speaking the same language. But yeah.
I think that's a good point, Dean, and to that extent, so in that case, AFIA, another example would be we're working with NAMI on the packer processor side. So we do need to be involved with the national programs, National Pork Board, NPPC. So another question.
Yeah, we were having a small sidebar over here about if there was a positive case on the sample testing, and one of the discussion points we're having is, the risk of that with this particular test is really, really low, a false positive at least, right? Like, so to have a false positive on this particular PCR test, just so everyone's aware, the risk of that is really, really low. It's a very, very, what we call specific test. So we just wanted to make sure the room was aware of that conversation.
It's Dr. Karen Hoefs, if you haven't met her. Brilliant and Karen, we appreciate you being involved in our committees as well. So, yeah, thanks for bringing that up. Other questions? Looking at Lawrence Parks. Lawrence, you want to make any comments from your area? Up here in front, if you would, John. This is Lawrence Parks with Parks Livestock, and you've been actively involved in another one of our working groups.
Yeah, we've been working closely. There's about 3 members of our group been working with Dr. Marsh on a routine basis since last September, putting together a set of protocols for the livestock dealer network. We took a look at the packers' rules and the producer rules, and we really operate differently than that. So we just felt like it'd be good to get a set of rules that we could follow for traceability, tracking, the same thing the producers and packers are doing. So we're well on our way for that and should have everything in place to present at the next meeting sometime later this summer.
Thanks, Lawrence. So that, taking into consideration some of the other live animal market channels, and because pig's pigs. Thanks. Other questions? I'll pick on Dr. Yeske again, if you wouldn't mind. You've been a strong advocate for this program. You were in several of the committees. You were at the House of Delegates. I mean, any final thoughts for this group as we wrap up the session? No pressure.
Yeah. Thanks, Tyler. No, I think it's been a tremendous effort to get everything coordinated and to get the ball moving forward, and that's really what this is all about. And I think as we go forward and we start doing some of the monitoring, for example, and getting some of those, hopefully get some of those easier tests done, and some of those things as we move into the future here and get better buy-in through the system. And I think it's a great opportunity for the industry to drive its own destiny. And if we're working with USDA instead of having USDA tell us what to do. And so I do think there's some real good opportunities to be on the forefront of it.
It is a paradigm shift, right? And you see it in a visual, but to really have industry, and I remember the call when you were helping the USDA understand, no, really, this is what we need. It's an opportunity for industry to influence USDA and set our own regulations, basically. So. Yeah,
and I think that's really where the rubber meets the road is we can say what's really doable, what's really not. And, what's going to make sense in the long run to make it a user-friendly procedure, but yet still have the ability to do what we want to do.